Good morning, one and all. We are here for our 44th online event of IAPWC Goa, and I'm really happy to re-announce that we have Dr. Sanalini again with us. Today, we are going to talk about a complete makeover of the mommy procedures, and thank you, Dr. Sanalini, for taking the invite again from us. So, without much delay, I would request the host, Dr. Lavi, please start with the webinar.
Am I audible?
Yes.
Good morning, one and all. I, Dr. Lavi Jain, would like to welcome you all for today's webinar organized by IIP Women's Cell Goa team. Today's topic is a complete guide to mommy's makeover procedures. Today we have among us Dr. Sonalini Pache. On behalf of IIP Women's Cell, I take an immense pleasure to welcome Dr. Sonalini Pache. Without wasting much time, I will start with Dr. Introduction. Dr. Sonalini has competing schooling from Dombivli, Mumbai. She did MBBS from Padma Shri Dr. D.Y. Patil Medical College, Pune, B&B General Surgery from Jaslok Hospital, Mumbai, MCH Plastic Surgery from Sheikh V.S. General Hospital, Ahmedabad, Fellowship in Aesthetic Plastic Surgery from Maharashtra University of Health Sciences, International Clinical Fellow at Birmingham and Stoke-on-Trent NHS Trust, Cosmetic Surgery Observerships at Villa Bella Clinic, Salo, Italy, and Academic Link in Stockholm, Sweden. Presently, she has practicing at Vision Hospital, Mapsa, and very soon planning to start her own aesthetic center. We welcome you, Dr. Sonalini Pache, for today's session. I request you to kindly start for today's topic. Welcome, Dr. Sonalini.
Thank you, Dr. Jain, for that kind introduction, and good morning, one and all. Thank you again for inviting me in your associations for a lecture. So, without much delay, I would start the presentation. So, my today's topic is a complete guide to mommy makeover procedures. So, what exactly is mommy makeover? Motherhood is one of life's greatest experience. Pregnancy and childbirth can have many effects on a woman's body, and things don't always go back to the way they were before. So, mommy makeover basically is a very familiar term which has personalized set of cosmetic procedures designed to help a woman address the common effects of childbearing. Basically, it deals with procedure or multiple procedures to restore or improve the effects on face, breast, tummy, and body. So mainly it is breast and tummy. It includes cosmetic surgery, non-surgical treatments, or a combination of both. So how can a woman benefit with these procedures? Pregnancy can leave lasting and often unwanted effects on a woman's appearance. Those can be like sagging, deflated breast, stretched abdominal muscles, and or loose excess tummy skin. Then there can be resistant fat pockets on the tummy and flanks, which are really resistant to diet and exercise. No matter what diet or exercise you follow, these tiny fat pockets are resistant, and they just don't allow a woman to regain back to the normal shape. There can be also vaginal laxity in case of multiple normal deliveries. So, by addressing these unwanted changes of pregnancy and restoring the appearance one desire, these procedures can help improve the comfort, self confidence, and in a way improve the way clothing and swimsuits fit. So, when can a woman have these procedures? Ideally, they should fully recover from the childbirth before undergoing any surgery. If one is considering any breast surgery, they should ideally wait till the breastfeeding is finished and allow the breast to return to a stable size and volume. It is best to wait until one is finished having kids before any kind of lifting procedures like tummy tuck, breast lift, or lower body lift. Because again, if you go for these procedures and get pregnant again, skin is bound to get loose and stretched, and breast is again going to sag. So it's always better to complete your family, and then you can do these kind of procedures, maybe a couple of years after the pregnancies. Also, if any surgery is contemplated, one may not be allowed to lift anything over 2 to 4 kgs for the first initial few weeks after surgery, so they will need help with the child care. To begin with, I'll start the pregnancy effects on breast. Due to hormonal effects, breast enlarge in size and volume during pregnancy and breastfeeding. As the breast enlarge, skin overlying is stretched and sometimes may develop stretch marks. Over a period of a year or two, as the breastfeeding is reduced, the breast undergo following changes: sagging or breast ptosis. Ptosis is basically a Greek word for fallen. So the breasts hang, and there is also deflation or loss of volume. Then the nipple areolar complex gets stretched. There could be asymmetry in breast size and volume, and sometimes there can be it in a opposite way. Breasts remain large and doesn't go back to the normal size. So what are the surgeries one can have in mummy makeover? It can be breast lift with or without breast augmentation. Uh, Breast augmentation, either it can be silicone based implant, silicone implant based augmentation, or one can use one's own fat to augment the breast. And in case of enlarged breast, one can undergo a breast reduction along with a lift. So breast lift, or which is medically called as mastopexy, can be done with or without augmentation. So a breast lift basically restores a firmer, perkier, and more aesthetically pleasing shape to sagging breast. This not only improves a patient's appearance by restoring her youthful feminine proportions, but also help one can fit into the bras and swimsuits more comfortably and attractively. In breast lift, excess stretched out skin is excised, restoring the breast tissue and raising the nipple areolar complex into a more forward position. The stretched and enlarged nipple areolar complex can also be reduced. The degree of breast sagging or ptosis is determined by Regnault's classification. This is basically based on nipple position in relation to the inframammary fold. So this is just a brief introduction to the classification. It could be my first degree, second degree, third degree, and there could be glandular just pseudotosis. So depending upon the nipple position at the IMF, the type of surgery is contemplated. So what are the types of mastopexy? For the mild sagging, a periolar or a donut lift can be done, which is on the right side corner. It corrects mild sagging with a single scar around the nipple areolar complex, and the breast is lifted up without much of breast tissue excision. Then there is a vertical or a lollipop lift. So there is a circular scar around the nipple areolar complex and a vertical scar going down. This can correct moderate sagging and provides more extensive reshaping. And then lastly, there is inverted anchor or inverted T scar or anchor lift, which has a circular scar around the nipple areolar complex, a vertical limb to the incision, and a horizontal incision, which is usually hidden in the inframammary fold. This gives a dramatic reshaping to correct the extensive sagging. It can also help reduce the breast as well, and augmentation procedures can be combined with these mastopexy procedures. So combination with breast augmentation. Many a times what happens, along with sagging of the breast, there is loss of volume as well. The breast usually gets concentrated in the lower half and the upper half remains flat. So what breast lift and augmentation can do, it can, with only mastopexy, it may not give a good rounded appearance to the breast. So many women opt for a simultaneous breast augmentation. Now, how can one achieve this? Either they can go for a fat transfer or they can go for a silicone breast augmentation. In fat transfer, what is done when we do the tummy tuck, or there is excess fat deposits on the tummy, the fat is sucked out using a liposuction machine. Then the fat is processed and the fat is injected into the breast. So who can benefit with this procedure? Those who do not want silicone implants, those are who are scared of having any foreign body in their breast, and those who are happy with a subtle augmented look. So fat transfer usually may give only 1 cup size increased in the augmentation. And if they desire for more, then they can go for multiple settings. And then silicone implants, the women who want a dramatic improvement in their breast augmentation, or they may want a couple of cup size more, so they can go for silicone implants. Silicone implants nowadays are completely safe. They give a good improvement and no need for any multiple surgeries like multiple fat transfers. With these newer nanotextured silicone implants, there is a very minimal risk of what is called as BIALCL, that is breast implant associated ALCL. It's a type of lymphoma which was initially seen in breast implant patients with the older textured implants. But with the newer nanotextured implants, there are hardly any case reports for this ALCL. Overall, it's one in, you can say, 1 lakh, there is risk of BIALCL. Over a period of 50 years of this silicone-based surgeries, around 80 to 90 case reports are reported for this ALCL. Otherwise, they are very safe to have these implant-based procedures. Mastopexy can also be combined with breast reduction. Some women may experience sagging of the breast along with large breast. So in these situations, they're very distressing as they interfere with clothing. They can have backache, they can have neck pain, bra straps indenting onto the shoulder, lack of confidence, inframammary fold, recurrent fungal infections. May lead to poor hygiene. The incisions are usually same as of mastopexy, that is circular donut lift or excision, and mainly there is a lollipop lift, that is the vertical scar is involved, or the anchor shaped scar. So post of what one can expect. Usually these surgeries are done under general anesthesia for the comfort of the patient and the surgeon as well. One may need 1 day of hospital stay. Otherwise, if there is not much of mastopexy done, then they can go home on the same day. Some soreness and swelling is expected, but with round-the-clock pain medications, this can be kept under control. Many patients return to work within a week of surgery. Exercise and physical activity can be resumed within 6 weeks, 6 to 8 weeks. The results are long-lasting and comparatively safe and rewarding procedure with minimal downtime. Then the effect of pregnancy on tummy and lower body. So what happens in pregnancy on the tummy? The abdominal skin is enormously stretched and not may develop. It does develop stretch marks in the lower abdomen. So what are stretch marks basically? Stretch marks are basically the rupture of dermis from inside. So they are scars which are there inside out. So usually after the surgery, there is scar which is seen outside, but stretch marks are scars which are seen, which are basically internal. And there is a dermal breakage, so skin doesn't heal that way. It doesn't contract the way it used to contract. So with multiple pregnancy, the core muscles or the rectus muscles also get weakened, and they may separate in the midline, giving a lax abdominal look, which is also called as recti divarication. In these cases, despite vigorous diet and exercise, there are stubborn pockets left on the central tummy, flanks, back, and thighs as well. Due to stretch marks, the skin doesn't shrink in the lower tummy, and it will never tighten, and it remains a loose hanging skin. In severe cases, women may develop umbilical hernia along with the recti divarication. So what is tummy tuck? Basically, it is abdominoplasty. No two patients start with identical concerns, nor will any two patients have same goals. A plastic cosmetic surgeon will always tailor according to your needs with least scarring possible. So there could be two types of tummy tuck surgeries. One is mini tummy tuck, which improves the lower belly with less extensive surgery. So some women usually don't have the upper abdomen fat pocket, but they do have a loose hanging skin in the lower belly. So in these cases, a mini tummy tuck may suffice. They are usually bothered with the stretch marks and the loose skin below the belly button area. So a single smiling incision is placed above the pubic mound. The core muscles are tightened and the smooth contoured flat abdomen is restored. We can also combine with minimal liposuction from the flanks. And then there is a classic or a full tummy tuck, which improves the upper and the lower abdomen as well. So it is combined with liposuction usually. Most of the time it is combined with liposuction, and so also called as lipo-abdominoplasty. So what is done in this, excess fat is sucked from the upper and the lower tummy folds. Once the skin fold has thinned out, the belly button is repositioned on a higher area, like not higher, but in a normal position. Because what happens due to pregnancy, the belly button and the skin hangs down. So belly button is repositioned in a normal position, and then the excess skin is cut out. So the incision in this full tummy tuck is slightly extended till the anterior superior iliac sign on both sides, and there is a hidden scar at the umbilicus. And if there is any associated umbilical hernia, this is also corrected, and the rectus muscles are tightened in the midline, giving a sculpted waistline. So the upper picture shows on the left side the normal rectus abdominis muscles, which are two strips of muscles in the midline. And what happens in pregnancy, they get stretched and the muscles separate. So there is diastasis in the rectus abdominis muscles. So the abdominal fat may protrude during breathing, and it gives a hanging appearance or a bulged appearance. So what is done in lipoabdominoplasty, all the fat is sucked out from upper and lower skin folds. The skin fold is thinned out, and then there is a incision placed in the bikini line, that is from anterior superior iliac spine on both sides. The skin is separated from the abdominal wall, exposing the muscles. In the third picture, if you can see, the muscles are tightened in the midline using a non-absorbable suture, a strong non-absorbable suture. So the core muscles are strong, and it gives a sculpted waistline as well. And then whatever the loose hanging skin is there, the excess skin is there, it is cut out in a tailored fashion. The umbilicus is repositioned in a higher position, and then it is sutured in scar, like a hidden scar in the waistline, or in the bikini, the scar gets hidden. In case of umbilical hernia, the umbilicus has to be excised, and a new umbilicus is formed in the normal position. So these are some real pictures. In this left side patient, there was umbilical hernia as well. So her umbilicus was excised, the hernia was repaired, and a new umbilicus was created, which looks like a normal one as well. And then it gives a good sculpted waistline as well. So what is usually done in tummy tuck? These surgeries are done in epidural anesthesia, and may be combined with the general anesthesia when there is fat to be sucked out from the upper abdomen, because if we suck out fat from the upper abdomen, it may give a little bit of discomfort only with epidural anesthesia. So in those cases, there is a combination of general anesthesia. 2 to 3 days of hospital stay is required, because initially there is a complete bed rest for a day, and then the patient is encouraged to walk the next day in a little bit of stooping position, so that there is no stretch on the incision line. Gradually, one resumes to the normal work. Initial soreness and discomfort is there, which usually subsides in a couple of weeks' time. There is a pressure garment to be worn for at least 6 to 8 weeks if it is combined with liposuction. Exercise and physical activity can be resumed in 6 to 8 weeks' time. Basically, tummy tuck results are drastic and are immensely rewarding. Like, one can go back to their normal clothing without any fear of tummy bulge or any awkwardness of tummy bulge. Then the surgeries Other surgeries which can be done for tummy tuck and lower body is only liposuction. Only liposuction is done when there is only limited fat pockets and minimal stretch marks. So in those cases, if one wants to have a limited surgery or a minimal downtime, then they can go only for liposuction of those fat pockets, and they are happy with that also. Liposuction combined with tummy tuck, as I spoke, called as lipo-abdominoplasty. In some women, what happens is there is fat deposits all over, like in the flanks, in the back. They have the breast rolls, like when we wear the bra, the folds which are there under the bra straps, those are called the breast rolls. So fat is everywhere basically. So in those women, what can be done is 360-degree liposuction. So all the fat pockets are emptied and the loose hanging skin can be circumferentially excised, what is called as belt lipectomy or circumferential tuck. Belt lipectomy can also be combined with a buttock lift, because with pregnancy and with weight gain, what happens, there is a lot of fat deposits in the buttocks as well. And once you start exercising and diet after the pregnancy, the buttock skin may sag. So with belt lipectomy, the buttocks skin can also be lifted, and that can give a good rounded shape to the waistline. And if the women are more desirous, a buttock augmentation can be done usually with implants or with fat. And thigh lift procedures. Then there is procedures involved for vaginal laxity also. So vaginal laxity is more likely to occur when there is more than one vaginal birth, normal birth, forceps delivery, or difficult delivery, or large baby, or even in normal aging as seen in menopause due to hormonal effect. So these procedures basically depend on the degree of laxity. As physiotherapists, you all know, we initially start with pelvic floor training, Kegels exercises to tighten this vaginal muscles. Even before this childbirth, prenatal exercises are begun to give a good vaginal muscle, tightened vaginal muscles. Later on also, for minimal laxity, laser or radiofrequency tightening can be done. So what happens in these energy-based devices, there is heating up of tissues, and then there is increased collagen production. So minimal tightening effect may be seen with these laser or radiofrequency devices. It may also help to treat mild stress urinary incontinence. There is less downtime in these procedures, but may need several sessions. And when do we go for surgical vaginoplasty? When there is severely lax vagina. It is helpful when there is a gap created between the vaginal muscles due to overstretching. Obviously, if this is surgery, it will involve a little bit of downtime of couple of weeks. And there is also a procedure of fat injection or fat transfer to the labia majora, which gives a youthful look in case of weight loss, severe weight loss during pregnancy. So what happens, the labia majora looks very flat and in line with the minora. So some women may go for fat transfer in these areas, and they are absolutely safe because the fat is injected in the superficial layer, in the superficial fat pocket. So nothing goes deep down and nothing is injured. So other customized procedures which can be done in mummy makeover is thigh lift. So lax thigh skin can be distressing, especially when some women, it comes to clothing, are like they are used to wear revealing or maybe short dresses. So this lax skin may be distressing for those women. In this case, excess skin is excised in such a way that the scar is hidden in the inner thigh. Liposuction is always the first option in case of bulky thighs, because Indian skin usually do not do well with large scars. Since we have more pigmentation than the Caucasian skin, Indian skin do get a bit of pigmented or stretched, and then these scars are visible. So I usually encourage them to go for only liposuction and not for large scars. Same happens with arm lift. These scars are usually placed in the inner arm. They are not that much revealing, but they do look ugly in case if one is prone to hypertrophic scarring or keloid. So in those cases, it becomes very distressing and ugly. So mainly it is reserved only for severe skin laxity and in case of post-bariatric surgery weight loss patients. In those patients, there is a lot of loose hanging skin. So one has to remove that excess skin. But if it is minimal or moderate, then one can be happy with liposuction only. Then there is a entity called as Brazilian butt lift. So it is just a fancy name, but what is done in Brazilian butt lift is it is combined usually with tummy tuck procedures, wherein when the excess fat is removed. So fat is usually a golden, like a liquid gold for the plastic surgeons, because it can be used in many ways. So what happens is the sucked out fat is removed, it is processed, it is washed, and then it is injected into these superficial fat pockets. So when fat is injected anywhere, usually 50 to 60% of the fat survives and rest of the fat gets absorbed in the body. So a subtle augmented look is there, and a good hourglass figure, it can be restored if a woman desires. And if they want more augmented look, then buttock implants can be done. These implants are usually silicone based, and they are safe if done in a proper way and by a board certified surgeon. Non-surgical based procedures can be, again, this can be basically for any woman who has had a weight loss, not necessary from pregnancy only. So the procedures which can be done is radio frequency skin tightening for minimal skin sagging in the mid cheek area, thread lift in case of minimal sagging. Then double chin fat is very resistant to go, so double chin correction can be done. So there is something called as geolysis, which is fat dissolving injection. Those can be given, or in case of heavy neck, liposuction can be done. Then injectables to give a good face rejuvenation, Botox injection, filler injection. Then female face also undergoes hormonal changes like melasma, which is skin pigmentation around the cheek and the nose. So laser procedures can be done in these cases, or just laser for skin rejuvenation, laser or chemical peels for skin rejuvenation. Then energy-based devices can be used for this fat pocket deposits around the tummy. If it is minimal, then nowadays there are many devices like Cool Sculpt. So they do help to a minimal extent. But if there are large fat deposits, these devices are not usually helpful. A lot of money is spent on this, and several sessions are required. So only it is done if there is minimal fat pockets. So in conclusion, I would like to say is, in reality, mommy makeover is just a marketing terminology. These procedures were done before, like 20 years back. So it traditionally refers to a combination of cosmetic surgeries of the breast, like mastopexy or augmentation along with a tummy tuck who has had children and wish to regain their pre-pregnancy look and confidence. So basically, a mummy makeover is a tailored or a customized procedure to each woman's goal for her makeover. There are no hard and fast rules. Also, some women have body changes similar to pregnancy. They may not be pregnant, but they may undergo similar body changes with significant weight loss or aging. So these procedures can be done in those women as well. So that's it. Thank you for listening.
Thank you so much, Dr. Sonalini, for giving us a valuable talk. I go overhead to Dr. Gori for another second part of the webinar question and answer part. Dr. Gori.
Good morning, everyone. Dr. Sonalini, it was a very detailed session on procedural and non-procedural interventions for the cosmetic issues faced by the mothers post-pregnancy. Now, we have a few questions coming from our viewers. We shall take it up one by one. The
Yes, please.
first question is, how does heat produced by laser helps in tightening vaginal muscles, as usually increased heat would cause increased circulation and hence relaxation?
So what this heat is done, it's not heat is not delivered till the inside. It is delivered till the dermis or the superficial layer, and it has a cooling effect also. So it's not that the woman is like completely in discomfort. So it has a cooling effect, and this heat, which is there minimally, it helps in collagen production. So the collagen which is there, which is not, usually not there in the lax vagina, so it helps in collagen production. So that is how it gets tightened. Similarly in face also, anywhere when these energy based devices are used.
Can I request you to switch off the screen share?
Oh, sorry, stop share.
Yeah,
Is
thank
that
you.
okay? Yeah. So even in face also, it works similarly. It breaks the initial collagen dermis, and then there is a neo collagen formation, which is good and which is tightened.
Okay, thank you, doctor. Our next question is, any side effects of procedures involving excising skin like thigh or arm lift is involved, or we have to take precautions about?
Yes, so as I said, I usually encourage females to go only for liposuction because Indian skin do not go well with the large scars. They do tend to get stretched and pigmented. And plus, if we usually do not combine simultaneous with liposuction, because what happens with liposuction, there could be dermal rupture, and there could be loss of when there is dermis rupture, we do not excise in the same time because it can lead to skin necrosis. So skin like thigh lift or arm lift is done after the liposuction, like couple of months after the liposuction, when there is loose skin. If there is any loose skin, then it is that much only skin is cut out. Otherwise, the first thing I always encourage, and everyone should encourage, be only liposuction, and then go for cutting out of the excess skin if one do want to do it. So there are side effects of skin necrosis. So there is a biggest risk of skin necrosis.
Thank you, doctor. Our viewers would also like to know if there's any particular diet to be followed pre and post excisional procedures.
Diet is basically a healthy, balanced diet. So low carbs, high protein, because what happens after any surgical procedure or on any, in that matter, acute illness or medical issues, in case of pregnancy and childbirth is not a medical illness, but it is when there is excess calories required. So one should go for low carbs and high protein diet and exercise in a normal way, and don't go for crash diets because they only deplete the nutrition and do not help in any way. So basically a healthy balanced lifestyle. I do
Thank you,
not
doctor.
for any particular diet. It's only good protein, exercise, and good diet.
Thank you, doctor. Next question is, could you explain how radio frequency helps in skin tightening?
So radio frequency is same thing. It heats up the dermal tissue. The initial collagen is broken down. So initially it may look a little lax, and then there is a new collagen formation. Over a period of 2 months, there is new collagen which is formed in the body, and that gives a tightened and good look appearance. So that's what is radio frequency. It initially breaks the collagen, and then a new collagen is formed under the dermis, in the dermis.
Thank you, doctor. Our next question is, does energy-based devices intervention help to reduce the fat deposition? because many of the brands advertise it, and many customers they get, and finally they see no results.
Yes,
So how much
so yeah, as I said in my previous slide, only minimal fat deposits, like only a small bulge, these cool sculpt or M sculpt devices may help. But then when there is big fat pockets in the flanks, like love handles and back fat pockets, they are not very much benefited with these devices, because it will require several sessions, and per session costs around maybe 15-20,000 or maybe more than that. So with 4 to 6 settings, you may get only maybe around 50 to 60% of improvement. But as against with liposuction, in one procedure all the fat is removed, and you can get a good sculpted look with like whatever you desire, one can get it. So these cool sculpting devices are only helpful in small fat deposits, small fat pockets.
Thank you, doctor. Now we'll go forward with our last question. If exercise regimen is not followed post the surgical procedures, can the changes be reversed over a period of time?
See, if exercise is not followed, then one may have little fat deposit. But if there is liposuction already done, fat may not get deposited in those areas. But wherein where the liposuction is not done, where like thighs or upper abdomen, suppose, or arms, fat may get deposited there. So basically, there is one thing that the patient selection is also has to be proper. So what usually my practice is, I usually ask their complete regimen of diet, exercise. I encourage, I encourage them to initial couple of weeks or maybe 1 month to follow a strict diet. Show me that you can reduce 1 or 2 kgs, and then only I go for liposuction or tummy tuck for those patients. If they are not motivated, then they are not good candidates for these procedures, because they will again going to regain back to their not, I may say, normal, because we are anyways going to cut out all the excess skin, but they may not appreciate the results of the surgery because they are not into those regimen. So one has to be very much motivated to undergo these procedures.
Thank you, doctor. I think most of our queries are addressed. So if any participants have more questions, they can write to us by the link provided. I request Dr. Lavi now to go forward with the session.
Good morning, one and all. I, Dr. Lavi Jain from IAP Women's Health Goa State Team, would like to take this opportunity to thank Dr. Sonalini Pache for giving us valuable talks to our IAP Women's Health Goa team on a complete guide to mummy makeover procedures. We are obliged to have you will with us for taking out your time and giving us such a wonderful presentation through this webinar. Would like to thank all the delegates for making this webinar a successful event. I would like to thank the whole team of IAP Women's Health Goa for organizing this event. Last but not least, I thank the IAP technical team for the support for providing us with a virtual platform to reach out to the entire physiotherapy community. Thanks, IAP Women's Health. Thank you.
Thank you again for having me here. Have a nice day to everyone.
Thank you, Dr. Sonalini. I would like to thank all the attendees to give your time in the morning. Have a nice day.
Thank you.